When I was a medical student 50 years ago, one of my professors once said to me, he said, "Sachs, we've had a patient in who's delirious." He says, "Go see the delirium in room 6. He didn't tell me anything about the human being who was delirious. It was the delirium in room 6. This is partly how doctors speak, or they say or the appendix in room 8. And it was, this turned out to be a very intelligent and delightful old tea planter who had spent much of his time in the Far East. And in his delirium, I listened to him for hours in his delirium. And basically, an entire life, the events of a life, his journeys, his loves, his passions, his ambitions, everything was somehow mixed up in his delirium. And I realized that in a way he was presenting an entire life in these sort of strange, confused, incoherent terms. And I started to listen, and after a while I started to join in and make some comments. It was actually almost like someone being privy to a dream. But this made me feel very strongly that this wasn't just a delirium, this was a particular human being who was delirious. And one had to address him. And so the particular human being has always been central for me. It's not enough to say, you know, that's a migraine, that's Parkinsonism. You have to say, what is life like for this particular person with migraine or Parkinsonism? Or whatever. How do they experience it? How do they respond? And so the human element and talking about life with something is certainly needs to be an essential part of medicine. I think it used to be, and then sometimes in the sort of mass medicine and quick diagnosis, and even with things like brain imaging, I think there's a tendency sometimes just to give a diagnosis and forget it. But certainly, that's people have to live with things.